Thank you for staying with us. Doctors Without Borders, MSF, is highly concerned about a significant risk of malaria and waterborne diseases, including cholera, following the recent severe flooding in Nigeria that swallowed vast parts of Maiduguri. Now, there's also fear that these crises could increase the levels of malnutrition in the area. MSF calls for urgent additional support, especially in terms of water, sanitation and medical care, to protect people already heavily impacted by long-term insecurity and unprecedented levels of malnutrition. The severe flooding has impacted an estimated 400,000 people. And to unpack this, we're joined by MSF Medical Activity Manager in Maiduguri, and that's Dr. Mohammed Abdullahi Bashir. Good afternoon. Glad to have you join me on the news. All right.
Thank you for having me.
Okay, let me kick off by asking what specific health risks and outbreaks have you observed in the aftermath of the recent floods in Maiduguri?
First of all, following the aftermath of this flood, we've seen increased cases of acute watery diarrhea, in other words, suspected cholera cases. We've already confirmed 2 cases as positive cases by the National Referent Laboratory in Abuja. So yes, we have seen increased cases of suspected cholera cases and also cases of malaria. This is a malaria season usually, but we expect to see more, and we are seeing more cases now. And because of the flood, we expect this malaria season to be extended, unlike the previous years. We've also seen cases of diphtheria, which is contagious because the camps are overcrowded. So diphtheria is a contagious disease that can easily be transmitted from one person to another. So also we've seen such cases all over the city.
Well, I can't just help but imagine how people are dealing with this catastrophe mentally. What psychological impacts are the residents facing due to this flood? And also, how is MSF addressing these challenges?
Actually, the psychological impact is very huge, especially in the first few days of the flood, where you wake up to see your house, your businesses. In fact, sometimes even your family members are gone. So it's very severe. And we've seen some cases in the camps and in our hospitals where we manage our patients for malnutrition. We've seen adults with such acute mental health conditions. And for those cases, we've referred them to the specialist, and then they have been managed. So MSF also is into this, supporting in management of mental health conditions following this flood, and also several non-governmental organizations are also supporting in that, to say that the adverse effects of psychological health conditions does not bring down the residents of Maiduguri. Yes, this is how MSF is supporting for the short term. But for long term, actually, I think we need much more to do because we need to rebuild those homes, which developmental activities. We need to do all those things. Other organizations should come in to support in these activities.
Well, I really wonder, Dr. Abdullahi, you've talked about psychological support MSF is providing, but beyond psychological support now, in terms of family and also children, are there any community structures or even support systems being created to help children and also families cope in the wake of this flood?
Yeah, in the first few weeks of flood, it's difficult to do that, actually. But now that people have started returning to their homes, that were not destroyed, before those destroyed, they are still in the camps. So this is the time that we will start these activities in the community to support those individuals. So other organizations also will start this definitely. But I'm sure more support is needed so that these families can their symptoms can be alleviated, and then the risk will not be intolerable.
All right, thank you so much. We do hope indeed relief is underway to those affected by flood in Maiduguri. Dr. Mohammed Abdullahi, MSF Medical Activity Manager, many thanks indeed for your time.
Thank you.